See if anybody wants to talk about the ongoing Kowalski versus Johns Hopkins All Children's Hospital. So it appears what has happened is this young lady, about 7 years ago, she was diagnosed with CRPS, which is complex regional pain syndrome, which is a diagnosis that maybe not all physicians are familiar with, and there's a little discrepancy among the diagnosis of it, but it was confused for Munchausen's by proxy at the hospital. So Munchausen's would be somebody is inflicting injury or faking an injury upon themselves for some sort of secondary gain, and the by proxy part would be if the inflictions or the faking of the illness was orchestrated by a third party. So in this case, they thought that it was the young lady's mother who was sort of making up this disease that they weren't very familiar with. The disease being CRPS, complex regional pain syndrome. And as such, it would appear that, well, this is, because I'm watching the trial, there's a discrepancy as to maybe who, I'm not giving legal advice here. I'm only an amateur. It's a little hobby. I like to watch court cases, especially if they're heavily medically involved like this one is. But it appears that it was perhaps the Child Protective Services of the state, which in this case is Florida, that took her away from her parents, specifically her mother, but they're saying that perhaps the hospital maybe was overexcited to have her taken away from her mother, which of course is going to cause the family stress. Another element is that the plaintiffs, the Kowalski family in this case, are stating that the hospital didn't treat her CRPS. They actually gave her a diagnosis whenever they attempted to transfer her to another hospital of Munchausen's by proxy, but yet at the end, when everything was said and done, the billing codes sent to the insurance company had a diagnosis of CRPS, so it appeared as if they were billing for CRPS, but yet telling the family and the other hospitals that she had Munchausen's by proxy. So, is anybody else following this? I said YouTube had 5 million views, so clearly someone besides me is watching this trial. Specifically, this morning, I had interviewed Dr. Park, who is in the office right next to mine, an expert in ketamine, because a lot of the witnesses here, some of them were expert witnesses, meaning that they were hired because they're going to talk about their opinions, are not just to be taken as any lay person's opinions, they're like expert opinions, but then some of the witnesses were just witnesses because they happened to have seen Maya, the girl plaintiff, the little girl plaintiff, who's now 17, by the way. So there's been a lot of doctors talking, whether hired to opine upon a specific issue that they are renowned in or because they had treated the little girl. And so lots of doctors talking, and they're not allowed to watch what the other witnesses say. And so there were some conflicting messages. Specifically, one of the physicians stated that there's no withdrawal whatsoever with ketamine. He was a pain management doctor, anesthesiology. And then another doctor came in who was a neurologist, and he said, well, in fact, there is withdrawal with ketamine. So that's why I met with Dr. Park this morning to figure out which one is it. And I think that it would be important for the person answering the question to specify in what location the ketamine used. Because what I think is that the anesthesiology pain specialist, when he said that there is no withdrawal, he was referring to ketamine used in a clinical setting being watched over by physicians. And I think the neurologist, when he responded, he maybe had in his mind like street use of ketamine because, that's unregulated and not safe. And I suppose street use of anything could result in withdrawals. So I think the jury was pretty confused. This is an interesting case or an interesting trial because most of the trials that I watch I don't know if it's because of the state, because the laws differ state by state, or if because this is civil instead of a criminal trial, but the jurors are actually allowed to ask the witnesses questions, which is not anything that I've seen in any of the other trials that I've watched. And I can tell that they're particularly confused about the conflicting information regarding ketamine because they have a lot of questions for the doctors. Like, can you tell us, is it addictive? Are there withdrawals, that sort of thing? So I did speak with Dr. Park this morning to clear up some of your questions regarding ketamine. And then that will be posted on YouTube. So my YouTube channel, which is Improve Life PLLC on YouTube. So just search Improve Life PLLC. So you'll be able to see that interview that I had with Dr. Park regarding ketamine. So ketamine is a real and viable treatment for CRPS, but I think having worked in an emergency room, perhaps many of the staff members were a bit shocked that a mom would come into the emergency room and then specifically say, like, she needs ketamine. I think maybe that raised some red flags because they didn't really understand that that is an actual legitimate treatment for CRPS. They just sort of probably just saw her as like a drug seeker type, which I know isn't like a good phrase, but I mean, that's what it's called. And another point I wanted to touch on is that they subpoenaed text messages, and one of the physicians has referred to the young patient as ketamine girl, and that is offensive because you just don't want to be known as ketamine girl. And I'm not defending this type of talk at all, but I will explain, when you work in the hospital, and especially if you work in different hospitals and you have clinic during the day and you're working at the hospital at night, you can see like 1,000 patients in 1 week. So, and plus when you text or whatever, you're not supposed to say the patient's name. So a lot of times in medicine, when we're talking to our colleagues or our friends that we work with, we're not going to say patient in room 203 because, you know, they move around a lot. We're going to say the specific identifying information about that patient that sticks out. And it makes sense to me that if a mom came in and said, like, I want all this ketamine from my doctor, the way that anybody treating her would remember her is as ketamine girl, which is not, I'm not justifying that that's a nice thing to call somebody, but like I had a patient who came in and blew his hand off because he was playing with fireworks. Like, we would call him like fireworks guy. Like, that's not nice, but like it is like one of the only ways we're gonna know. Because if I said, first of all, I can't say the patient's name, so I can't be like Bob Smith, you know. And then if I said, you know, the guy in room whatever, like when we talk about patients to our colleagues, we say like fireworks guy, ketamine girl, and it's not nice, and it definitely looks horrible when it's being read in a jury that they called her ketamine girl. Like, that's offensive. But I can see that in the hospital, like, that would be a way to convey who you're speaking about, because again, you can't use names and people move room to room, and MRN numbers are like 50 digits long, and instead of saying ketamine girl, you'd be like patient 073582437 blah. Like, so it is offensive, and maybe there's something that could be done about it, but referring to patients by like the thing that sticks out, like fireworks guy, I'm sure he wouldn't like to be referred to as fireworks guy, but you know, you might have 50 patients that have hand injuries in a week, and so identifying him as fireworks guy would be the way to like convey who specifically you're talking about. But anybody want to say anything about this case? Anybody else following it? Anybody have questions about complex regional pain syndrome or the treatment of ketamine? Anybody have any questions about Munchausen's or Munchausen's by proxy? Anything like that? You guys are all just eavesdropping. Well, you can DM me some questions if you have them, but I think I took care of most of your questions regarding ketamine when I spoke with Dr. Park this morning. That will be up on all my social medias, so it'll be here on Instagram and on TikTok, which is Improve Life PLLC. You just search for that. Same thing on YouTube. So the full video will be available on YouTube, and then parts of the video will be available here. And have a good day, everybody.